41. A patient is receiving chemotherapy and is at risk for neutropenia. Which of the following should the nurse instruct the patient to avoid? A. Large crowds and people with infections. B. Eating a high-protein diet. C. Using a humidifier in the home. D. Drinking fresh fruit juices. Answer: A. Large crowds and people with infections. Rationale: neutropenia makes the patient vulnerable to infections, so avoiding crowds and people who are ill is essential to reduce the risk of exposure. A high-protein diet can support immune function. 42. A patient with lung cancer is experiencing severe pain. Which of the following is the most appropriate initial intervention? A. Administer prescribed opioids for pain relief. B. Apply a hot compress to the affected area. C. Provide relaxation techniques to manage pain. D. Encourage the patient to walk for pain relief. Answer: A. Administer prescribed opioids for pain relief. Rationale: opioids are the most effective treatment for severe cancer pain, providing quick relief. Non-pharmacologic methods may be used in conjunction, but should not replace analgesic medications for severe pain. 43. A patient with metastatic melanoma is receiving targeted therapy. What is the most common side effect of this treatment? A. Diarrhea. B. Weight gain. C. Hair loss. D. Skin rash. Answer: D. Skin rash. Rationale: skin rash is a common side effect of targeted therapies, particularly those for melanoma. Monitoring for and managing this side effect is crucial in providing care. 44. A patient undergoing radiation therapy for throat cancer is complaining of dry mouth. What is the best intervention? A. Encourage the patient to chew gum. B. Recommend the use of a saliva substitute. C. Suggest the patient drink caffeinated beverages. D. Provide vitamin C supplements. Answer: B. Recommend the use of a saliva substitute. Rationale: radiation therapy can cause xerostomia, dry mouth. Using a saliva substitute helps manage this side effect. Chewing gum may help but isn't as effective as a substitute specifically designed for dry mouth. 45. A nurse is caring for a patient with cancer who is receiving chemotherapy. The patient is experiencing nausea and vomiting. Which of the following interventions should the nurse prioritize? A. Administer antiemetic medications as prescribed. B. Offer small, frequent meals to prevent nausea. C. Restrict the patient's fluid intake to prevent vomiting. D. Encourage the patient to sleep for several hours. Answer: A. Administer antiemetic medications as prescribed. Rationale: antiemetic medications are the first-line treatment for nausea and vomiting associated with chemotherapy. They provide effective relief to improve patient comfort. 46. A patient with cancer is experiencing anxiety about the prognosis. What is the best response by the nurse? A. Don't worry, everything will be fine. B. It's important to stay positive and think about treatment. C. It's normal to feel anxious. Let's talk about your concerns. D. You should try not to think about the prognosis. Answer: C. It's normal to feel anxious. Let's talk about your concerns. Rationale: acknowledging the patient's anxiety and providing a supportive environment to discuss concerns helps reduce fear and provides emotional support. Offering empty reassurances can invalidate the patient's feelings. 47. A patient with lymphoma is experiencing pain in the chest area due to enlarged lymph nodes. What is the priority nursing intervention? A. Administer prescribed pain medications. B. Apply heat to the affected area. C. Encourage deep breathing exercises to reduce discomfort. D. Encourage the patient to avoid lying down. Answer: A. Administer prescribed pain medications. Rationale: the priority intervention is pain management. Administering prescribed pain medications helps alleviate discomfort and improve the patient's quality of life. 48. A nurse is caring for a patient with leukemia. The patient is at high risk for bleeding. What should the nurse monitor for? A. Sudden weight gain. B. Petechiae and bruising. C. Increased urine output. D. Nausea and vomiting. Answer: B. petechiae, and bruising. Rationale: leukemia can cause low platelet counts, leading to increased risk of bleeding. Monitoring for signs such as petechiae, small red spots under the skin, and bruising is crucial. 49. A patient with colon cancer is receiving palliative care. What is the focus of care at this stage? A. Cure the cancer and extend survival. B. Provide comfort and relieve symptoms. C. Administer chemotherapy to shrink tumors. D. Focus on preventing further metastasis. Answer: B. Provide comfort and relieve symptoms. Rationale: palliative care focuses on relieving symptoms and providing comfort rather than curing the disease. This approach is aimed at improving the quality of life for patients with advanced cancer. 50. A patient with breast cancer is receiving chemotherapy and is experiencing a decrease in white blood cell count. What is the priority nursing action? A. Provide a high-protein diet to boost immune function. B. Encourage the patient to rest and avoid exercise. C. Implement infection control precautions. D. Administer growth factor medications. Answer: C. Implement infection control precautions. Rationale: a low white blood cell count increases the risk of infection. Infection control precautions are essential to protect the patient from potential infections while their immune system is compromised. 51. A patient with advanced lung cancer is receiving hospice care. Which of the following is the priority goal of care? A. Cure the cancer. B. Provide pain relief and comfort. C. Perform aggressive treatments to extend life. D. Administer chemotherapy to control the disease. Answer: B. Provide pain relief and comfort. Rationale: in hospice care, the primary focus is on providing comfort and relieving symptoms, not curing the disease or performing aggressive treatments. 52. A patient with cancer is experiencing severe nausea and vomiting. What is the nurse's priority intervention? A. Offer clear fluids only. B. Administer prescribed antiemetic medications. C. Encourage small meals and snacks. D. Increase the patient's fluid intake. Answer: B. Administer prescribed antiemetic medications. Rationale: the first step in managing severe nausea and vomiting from chemotherapy is to administer antiemetic medications as prescribed. 53. A patient with leukemia is at risk for infection. What should the nurse include in the care plan? A. Provide a high-fiber diet to boost immunity. B. Restrict all visitors, including family. C. Perform frequent hand hygiene and wear gloves. D. Keep the patient in a private room without any visitors. Answer: C. Perform frequent hand hygiene and wear gloves. Rationale: protecting the patient from infection is essential, and frequent hand hygiene and the use of gloves help minimize the risk of transmission. 54. A nurse is caring for a patient undergoing radiation therapy. What is the most important action to prevent skin irritation in the irradiated area? A. Apply aloe vera gel to the skin. B. Use a mild soap to cleanse the skin. C. Expose the skin to direct sunlight. D. Apply hot compresses to the skin. Answer: B. Use a mild soap to cleanse the skin. Rationale: using a mild soap helps minimize irritation in the skin that is undergoing radiation therapy. Avoiding sun exposure and hot compresses are also crucial for preventing further skin irritation. 55. A patient is receiving chemotherapy and is at risk for mucositis. What is the nurse's priority intervention? A. Encourage the patient to drink hot beverages. B. Teach the patient to use mouth rinses with salt water. C. Instruct the patient to avoid brushing their teeth. D. Recommend using mouthwash containing alcohol. Answer: B. Teach the patient to use mouth rinses with salt water. Rationale: saltwater mouth rinses help soothe and cleanse the mouth, reducing inflammation and preventing infection in patients with chemotherapy-induced mucositis. 56. A nurse is teaching a patient with prostate cancer about hormonal therapy. Which statement indicates the patient understands the teaching? A. Hormonal therapy will shrink the tumor. B. Hormonal therapy will stop the cancer from spreading. C. Hormonal therapy will help reduce the size of the prostate. D. Hormonal therapy will help manage symptoms and reduce tumor growth. Answer: D. Hormonal therapy will help manage symptoms and reduce tumor growth. Rationale: hormonal therapy for prostate cancer is aimed at reducing symptoms and slowing tumor growth, rather than curing the disease. 57. A nurse is caring for a patient with colorectal cancer who is scheduled for surgery. What is the priority preoperative teaching? A. Discuss the risks of radiation therapy. B. Explain the need for bowel preparation. C. Encourage the patient to stop taking all medications. D. Teach about the importance of postoperative pain control. Answer: B. Explain the need for bowel preparation. Rationale: bowel preparation is necessary before colorectal surgery to clear the intestines for optimal surgical outcomes. This teaching is a priority in the preoperative phase. 58. A patient with oral cancer is receiving chemotherapy and is experiencing dry mouth. What should the nurse recommend? A. Suck on sour candies. B. Drink caffeinated beverages. C. Use a saliva substitute. D. Avoid drinking water. Answer: C. Use a saliva substitute. Rationale: chemotherapy can cause xerostomia, dry mouth. A saliva substitute helps relieve the discomfort and prevents complications like difficulty swallowing and speaking. 59. A patient with cancer is experiencing fatigue. Which intervention should the nurse recommend to help manage this symptom? A. Encourage frequent naps during the day. B. Provide energy drinks. C. Encourage a balanced diet with small, frequent meals. D. Encourage the patient to remain in bed most of the time. Answer: C. Encourage a balanced diet with small, frequent meals. Rationale: a balanced diet with small, frequent meals can help improve energy levels and manage fatigue. Encouraging bed rest may exacerbate the feeling of fatigue. 60. A patient with breast cancer is experiencing lymphedema after a mastectomy. What should the nurse teach the patient? A. Keep the affected arm elevated. B. Perform vigorous exercise with the affected arm. C. Apply heat to the affected area. D. Keep the affected arm immobilized. Answer: A. Keep the affected arm elevated. Rationale: elevating the affected arm helps reduce swelling in patients with lymphedema following mastectomy. Vigorous exercise and heat may worsen the swelling. 61. A nurse is caring for a patient with advanced ovarian cancer. Which symptom is most likely to occur due to the progression of the disease? A. Fever. B. Abdominal bloating and discomfort. C. Sudden weight loss. D. Severe headache. Answer: B. Abdominal bloating and discomfort. Rationale: ovarian cancer often causes abdominal bloating and discomfort as the tumor grows and places pressure on surrounding structures. Fever is not a typical symptom of advanced ovarian cancer. 62. A nurse is providing care for a patient with end-stage cancer who is experiencing severe pain. What is the priority nursing action? A. Administer opioid analgesics as prescribed. B. Reposition the patient for comfort. C. Provide distraction techniques. D. Encourage deep breathing exercises. Answer: A. Administer opioid analgesics as prescribed. Rationale: the priority action for managing severe cancer pain is to administer opioid analgesics as prescribed, ensuring effective pain relief. Other interventions can supplement pain management. 63. A nurse is caring for a patient with head and neck cancer. What is a common side effect of radiation therapy in this patient? A. Dry mouth, xerostomia. B. Excessive salivation. C. Weight gain. D. Increased appetite. Answer: A. Dry mouth, xerostomia. Rationale: radiation therapy for head and neck cancer often causes xerostomia, dry mouth, due to damage to salivary glands. This requires management with saliva substitutes and hydration. 64. A patient with cancer is experiencing constipation due to chemotherapy. What is the best nursing intervention? A. Administer a stool softener as prescribed. B. Increase the patient's fluid intake. C. Restrict the patient's diet to low-fiber foods. D. Encourage the patient to avoid physical activity. Answer: A. Administer a stool softener as prescribed. Rationale: constipation is a common side effect of chemotherapy. Administering stool softeners helps relieve this symptom and prevent complications. 65. A patient with leukemia is undergoing chemotherapy and develops fever and chills. What is the nurse's priority action? A. Administer the next dose of chemotherapy. B. Notify the healthcare provider and obtain cultures. C. Apply cool compresses to the patient's forehead. D. Encourage increased fluid intake. Answer: B. Notify the healthcare provider and obtain cultures. Rationale: fever and chills may indicate an infection, a common complication of chemotherapy. The priority is to notify the healthcare provider and obtain cultures to identify the infection and initiate treatment. 66. A patient with colon cancer is scheduled for a colostomy. What is the priority preoperative teaching? A. Teach the patient about the procedure and its purpose. B. Provide information about the chemotherapy regimen. C. Advise the patient to avoid all solid foods before surgery. D. Instruct the patient to discontinue all medications. Answer: A. Teach the patient about the procedure and its purpose. Rationale: it is essential to educate the patient about the colostomy procedure and its purpose to reduce anxiety and ensure the patient understands the postoperative care and lifestyle changes. 67. A patient with leukemia is undergoing a bone marrow biopsy. What is the priority nursing action after the procedure? A. Apply a warm compress to the biopsy site. B. Monitor the patient for signs of infection. C. Apply pressure to the biopsy site to control bleeding. D. Encourage the patient to ambulate immediately. Answer: C. Apply pressure to the biopsy site to control bleeding. Rationale: the priority after a bone marrow biopsy is to apply pressure to the biopsy site to control bleeding, as this is a common complication. Close monitoring for signs of infection follows. 68. A patient with cancer is experiencing anorexia and weight loss. What is the priority nursing intervention? A. Offer high-calorie foods frequently. B. Provide a low-protein diet to minimize strain. C. Encourage fluid restriction to reduce bloating. D. Offer bland, low-fat foods. Answer: A. Offer high-calorie foods frequently. Rationale: offering high-calorie foods frequently helps to combat anorexia and weight loss in cancer patients. This promotes weight maintenance and provides adequate nutrition. 69. A nurse is caring for a patient with leukemia who is undergoing chemotherapy. What should the nurse monitor for regarding complications? A. Elevated blood pressure. B. Decreased platelet count. C. Increased blood sugar levels. D. Increased respiratory rate. Answer: B. Decreased platelet count. Rationale: chemotherapy often causes myelosuppression, leading to a decrease in platelet count. This increases the risk for bleeding and requires close monitoring. 70. A nurse is caring for a patient with pancreatic cancer. What is the priority intervention for managing pain in this patient? A. Encourage the patient to use relaxation techniques. B. Administer prescribed pain medications as needed. C. Offer a high-protein diet to support healing. D. Promote deep breathing exercises. Answer: B. Administer prescribed pain medications as needed. Rationale: the priority intervention for managing pain in a patient with pancreatic cancer is to administer prescribed pain medications. Pain management is essential in improving the patient's quality of life. 71. A nurse is caring for a patient receiving radiation therapy for head and neck cancer. What is the priority nursing intervention to prevent side effects? A. Encourage the patient to use mouthwash with alcohol. B. Teach the patient to avoid hot foods and drinks. C. Encourage the patient to perform vigorous exercise. D. Apply a heating pad to the affected area. Answer: B. Teach the patient to avoid hot foods and drinks. Rationale: radiation therapy can cause mucositis and oral dryness. Avoiding hot foods and drinks prevents further irritation to the mouth and throat. 72. A patient with breast cancer is receiving chemotherapy and experiences severe nausea. What is the priority nursing action? A. Offer small, frequent meals. B. Administer antiemetic medications as prescribed. C. Encourage the patient to drink ginger tea. D. Provide a comfortable environment with dim lighting. Answer. B. Administer antiemetic medications as prescribed. Rationale. Antiemetic medications should be administered as prescribed to manage nausea and vomiting caused by chemotherapy. Other interventions can be used as adjuncts. 73. A nurse is caring for a patient with lung cancer who is experiencing dyspnea. What is the priority nursing intervention? A. Administer oxygen therapy as prescribed. B. Encourage deep breathing exercises. C. Provide a humidifier in the room. D. Encourage the patient to sit up and lean forward. Answer. A. Administer oxygen therapy as prescribed. Rationale. The priority intervention for dyspnea in a patient with lung cancer is to administer oxygen therapy as prescribed to alleviate hypoxia and ease breathing. 74. A patient with colon cancer is undergoing chemotherapy and develops diarrhea. What should the nurse include in the care plan? A. Restrict the patient's fluid intake. B. Administer antidiarrheal medications as prescribed. C. Encourage the patient to consume high-fiber foods. D. Provide the patient with clear liquids only. Answer. B. Administer antidiarrheal medications as prescribed. Rationale. Diarrhea is a common side effect of chemotherapy. Administering antidiarrheal medications helps manage the condition and prevent dehydration. 75. A nurse is providing care to a patient with breast cancer who is undergoing radiation therapy. Which of the following instructions should the nurse give to reduce skin irritation? A. Apply lotion with alcohol to the irradiated skin. B. Use a mild soap and avoid scrubbing the skin. C. Expose the skin to direct sunlight for healing. D. Apply heat to the irradiated area. Answer. B. Use a mild soap and avoid scrubbing the skin. Rationale. Using mild soap and avoiding scrubbing prevents further irritation of the skin undergoing radiation therapy. Excessive heat or sun exposure can worsen skin irritation. 76. A nurse is caring for a patient with advanced cancer who is experiencing pain. Which of the following is the most appropriate intervention? A. Administer opioid analgesics as prescribed. B. Encourage deep breathing exercises. C. Provide a warm compress to the painful area. D. Suggest acupuncture for pain relief. Answer. A. Administer opioid analgesics as prescribed. Rationale. Opioid analgesics are the most effective way to manage severe cancer pain. Other interventions can complement pain relief, but should not replace opioid therapy for moderate to severe pain. 77. A nurse is caring for a patient with leukemia who is receiving chemotherapy. The patient has developed neutropenia. What is the priority nursing action? A. Place the patient in a private room. B. Restrict all visitors, including family. C. Encourage frequent hand hygiene and use of gloves. D. Administer a blood transfusion. Answer. C. Encourage frequent hand hygiene and use of gloves. Rationale. Neutropenia increases the patient's risk for infection. Hand hygiene and the use of gloves help reduce the risk of infection. Isolation and visitor restrictions are also important, but hygiene is the first line of defense. 78. A nurse is teaching a patient with prostate cancer about the side effects of hormone therapy. Which of the following statements indicates that the patient understands the teaching? A. I may experience a decrease in sexual desire. B. My energy levels will increase with hormone therapy. C. Hormone therapy will help me gain weight. D. I will feel more energetic during hormone therapy. Answer. A. I may experience a decrease in sexual desire. Rationale. Hormone therapy for prostate cancer often leads to decreased libido as a common side effect. Patients need to be informed about this potential outcome. 79. A nurse is caring for a patient who is receiving chemotherapy for leukemia. Which of the following findings should the nurse report immediately? A. Decreased appetite and weight loss. B. Temperature of 101.4 degrees Fahrenheit 38.6 degrees Celsius. C. Diarrhea and nausea. D. Fatigue and malaise. Answer. B. Temperature of 101.4 degrees Fahrenheit 38.6 degrees Celsius. Rationale. A fever of 101.4 degrees Fahrenheit 38.6 degrees Celsius in a patient undergoing chemotherapy is indicative of an infection, which requires immediate intervention, especially since the patient may be immunocompromised. 80. A patient with esophageal cancer is receiving radiation therapy. Which of the following instructions should the nurse give to the patient? A. You can eat any foods you want. B. Avoid eating hot and spicy foods. C. It is okay to drink alcohol while receiving treatment. D. You should increase your intake of red meats. Answer. B. Avoid eating hot and spicy foods. Rationale. Radiation therapy can cause irritation to the esophagus, and hot or spicy foods may exacerbate this irritation. Patients should be instructed to avoid these foods.